Our understanding of COVID-19's relationship with the heart is evolving. New research suggests the virus could contribute to a variety of cardiac issues, some of which could have lasting effects. Joining us this morning is Dr. Gavin Oudit, a cardiologist and professor at the University of Alberta. Thanks for joining us.
Great. Thank you for having me.
Your team at U of A recently published research which centered on the ACE2 enzyme, which is produced throughout the body, including around the heart, and is also a receptor which the COVID-19 virus seems to bind to. So could the ACE2 enzyme explain this relationship that we're discovering between COVID-19 and heart disease?
Absolutely. It's unfortunately, this is a very important enzyme in the body that unfortunately has been hijacked by the SARS coronavirus 2 and is now being used as its receptor. Part of an important reason why COVID-19 is so problematic is that ACE2 is widely expressed, and that includes being highly expressed in the heart, where this virus can actually attack, in particular, the vasculature of the heart and lead to myocarditis and vascular dysfunction and myocardial damage.
Yeah, a German study. Go ahead, finish, doctor.
Yeah, but importantly, the ACE2 is widely expressed. So it's in the lungs, it's in the gut, it's in the cardiovascular system, it's in the kidneys, it's in the central nervous system, which is why COVID-19 patients do so poorly when they get very sick. It really is a multisystemic disease.
A German study that was published just this summer looked at 100 COVID-19 patients. They found evidence of heart inflammation in 60 of them. So what does this suggest about the lasting effects of COVID-19? We know it's very serious while a patient's going through it. We're now discovering that it can have long-lasting effects, in particular on the heart.
Right. And so this is an important study because they actually studied patients that recovered from COVID-19. So these were not acutely sick, hospitalized patients. These were patients that recovered, and yet 60% of them had ongoing evidence of inflammation and myocardial damage. So I think what we might be seeing here is a widespread prevalence of heart disease in patients with COVID-19. It means follow-up care and monitoring and treatment of these patients are going to be important even after COVID-19 has gone away. So I think there are going to be long-lasting effects, unfortunately, of COVID-19, and we all need to be vigilant. And certainly cardiovascular specialists, but other healthcare providers. And these patients need to be seen promptly, routinely, and cardiovascular needs to be diagnosed and treated accordingly.
Yeah, that brings up an interesting point. How does this change how we care for COVID-19 patients?
Well, it's important. Obviously, virtual care is something that's relatively new to us, and we should be doing that more and more. But also seeing patients when they're sick in person is important. And an important message for all healthcare providers: if patients are sick, they do need to come into hospital and get the appropriate care. As you know, heart disease is something that's very serious, and we encourage our patients that when they do get sick to come to the hospital if needed. And I think having that ongoing care, whether it's virtual or in person, is very important for our patients.
Yeah, we're still learning so much about this virus, and this is just something new and all the more reason to stay on top of precautions. Dr. Gavin Oudit joining us from U of A this morning. Thank you.
Great. Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.